risk assessment and fall prevention in older adults. Part 1. Introduction. The demographic structure of Thailand has become aging society since 2005, with the proportion of the population aged 60 years and over as high as 10%. According to the population projection of the Office of the National Economic and Social Development Board (NESDB), in 2021, Thailand will enter complete aged society when the population aged 60 years and over accounted for as high as 20%. In 2031, Thailand will become super-aged society when the population aged 60 years and over accounted for as high as 28% of the total population. National statistics show that the population ages over 65 had at least 1 fall per year, and about 50% tends to have a recurrent incidence. This becomes a government burden on medical expenses. The cause of fall are due to deterioration of bodily functions with age or illness in the elderly, decreases visual acuity, sensory and tactile control, impaired balance and movement, use of central nervous system depression, stress and anxiety, fear of falling, etc. Many older people with internal organ injuries, head injuries, and pelvic fractures require longer hospital stay, and some people die later. Objectives: 1. To assess the risk of falls in the elderly. 2. To prevent falls in the elderly. Part 2. Equipment. 1. Visual acuity chart, strengthen visual acuity. 2. Stopwatch. 3. Chair with a backrest and armrest. 4. Thai fall risk assessment test, Thai FRAT. Part 3. Nursing practice. Fall risk assessment. 1. Eyesight measurement. Measure the eyesight of the elderly by installing or having someone else hold the visual acuity chart in a well-lit place. Have the elderly stand or sit 6 meters away from the chart. Cover the right eye. Read the chart from the top row down to the row of 6 to 12. Then switch to cover the left eye and read the chart in the same way as the right eye test. Assessment summary. If readings at the row of 6 to 12 are correct more than half of both sides, it means the eyesight is normal. If the readings are correct less than half on any side, it is considered visual impairment on that side. Moreover, elderly people who observe themselves to have blurred vision or unclear vision while reading should be advised to see a doctor for confirmation and correction. 2. Four-state balance. This is a test of balance while standing still, from easy to difficult. Methods. Have the elderly stand on bare feet without walking aids and any supports. The assessor helps the elderly to be in the desired position first. When the elderly be able to stabilize, timing will be counted. The elderly must remain in this position for 10 seconds without moving their feet or helping for balance. Test with the same method until 4 exercises are complete as follows. First pose, stand with feet together. Second pose, stand on foot connected to half foot. Place the big toe of the back foot connected to the widest area of the front foot. Let the elderly shoot with foot to put in the front. Third pose, stand on connected feet. Place the back foot next to the heel of the front foot. Let the elderly shoot with foot to put in the front. Fourth pose, stand on one leg. Interpretation. Failure to stand with feet connected for 10 seconds is to be at risk of falling. 3. Time up and go test. TUGT. It is a measure of how healthy the elderly people are and how much they are at risk of falling. It is a walking test with a defined method by observing the walking posture and measuring the time it takes to walk. Methods: have the elderly get up from a chair with armrests and walk in a straight line for 3 meters. Turn around and walk back to sit on the chair. Measure the time from getting up from the chair and walking back to sit. Interpretation: normally, the elderly should take 10 seconds or less. If this takes 30 seconds and over, then there is a list of falls. 4. Use of the fall list assessment in the elderly. Thai fall list assessment test. Thai DAT FRAT. This assessment includes the evaluations of various risk factors of falls in the elderly, then weight to a score in each factor as shown in the assessment form. For example, risk factor 1, gender, female scored 1, male scored 0. Risk factor 2, impaired vision, unable to read numbers more than half at a distance of 6 to 12 meters, scored 1. Read numbers more than half at a distance of 6 to 12 meters, scored 0. Risk factor 3, impaired balance, unable to stand with feet connected in straight line or stand for less than 10 seconds, scored 2. Stand with feet connected in straight line for 10 seconds, score 0. Risk factor 4, medication. Take one or more of the following drugs: sleeping pills, tranquilizers, hypertensive drug, diuretics, or take 4 or more drugs, including vitamins, scored 1. Do not take the following drugs: sleeping pills, tranquilizers, hypertensive drugs, diuretics, or take any but less than 4 drugs, score 0. Risk factor 5, history of falls. Have a history of 2 or more falls in the past 6 months, score 5. No history of falls, score 0. Risk factor 6, housing conditions. Live in a house with a platform height of 1.5 meters or more, score 1. Do not live in a house with a platform height of 1.5 meters or more, score 0. The total score of all risk factors is 11. Interpretation: a total score of 4 or more indicates list of falls. Part 4. Falls prevention in older adults. Exercise to prevent falls. Stretching and joint flexibility exercise. Pose 1 to 3. 1. Head exercise. Stand straight. Look forward. Slowly turn your head to the right as far as you can. Then slowly turn your head to the left as far as you can. Repeat 10 times. 2. Back stretch. Stand straight. Look forward. Let shoulders wide apart. Place palm on the back of your waist. Slowly lean back until you feel tight. Then return to stand straight. Repeat 10 times. 3. Body exercise. Stand straight. Look forward. Hands placed at the waist. Twist the upper body to the right as much as possible, without twisting the hips. Then twist the upper body to the left as much as possible. Repeat 10 times. Muscle strength exercise. Pose 4. 4. Ankle exercise. Start one side at a time. Begin from the right side first. Lift the right leg off the floor. Slowly lift the toes, then lower the toes. Repeat 10 times. Balance exercise. Pose 5. 5. Get out of the chair without hands to support. Sit in a chair with a strong backrest, not moving and not too low. Press the feet on the floor and behind the knees line. Slowly lean the upper body forward and then stand up without hands to support. Repeat 10 times. Evaluation 1. Assess the risk of falls in the elderly. 2. Prevent falls in the elderly. Precaution 1. Precautions before exercising. If there are any congenital diseases such as ischemic heart disease, paralysis or cerebrovascular disease, nerve compression especially in the neck and back, and severe osteoarthritis, should consult a doctor before exercising. 2. The pose that cannot be done should be skipped or reduced as appropriate. 3. In case of doing exercise and having the following symptoms, should consult a doctor. Dizziness or fainting, chest pain, shortness of breath, difficult breathing, severe pain on the joints,